Okay, I think we're already live on TikTok. No, that's so funny. The lighting's like. Okay, here we go. Okay, let's see. We're live on YouTube. Hopefully, you guys on YouTube are gathering together. We are live on TikTok, and we are now live on Instagram. We're going to give everybody a moment or two to filter in. And just to sort of remind everyone, this is Tuesdays with me, Dr. Taz. It's your opportunity to ask me anything, any questions you might have, anything that is on your mind, maybe something that's just bugging you, or you just want to share an interesting story. Totally up to you. I'll be digging into a couple of things in just a minute that have caught my eye, but it's been an exciting week. Now, a lot of people are getting sick. Let me back up and talk about that. I was on CBS this morning, Atlanta First News, talking about how so many people are getting weird viruses, even adenovirus, which is a typical pediatric virus that gives you like the pink eye and the runny nose and maybe a sore throat, is in full force with even adults getting super sick too. Has that happened to any of you guys? I don't know if it has, but this weekend Nick was sick, super sick, like had trouble really participating in any of the fun stuff we had planned. And then I know like I've had 2 or 3 call outs at the practice, so it's definitely sick season. And it's weird because it's like 20 or 30 degrees here in Atlanta, but it's supposed to be 80 degrees by the end of the week. So what's happening with this crazy weather? None of us know, and none of us can really figure it out. But I want to bridge 2 main concepts together. Number 1 is your immune system. If you guys are getting sick a lot, we talked about this a little bit on my segment today at CBS. If you're getting sick a lot, remember there are things you can do to boost your immune system. And a lot of it centers around things your mom told you, right? Make sure you get plenty of rest, make sure you're drinking lots of water, not getting too much sugar in your diet. All of those things deplete the immune system and do indeed make you sicker. But in addition to that, there are supportive things that we use in our family and I talk about in practice over and over again. So one of them, for example, is using astragalus root, which we know really boosts immune function, helps to decrease viral load. I love doing that every day and then even increasing it to 3 times a day. And it is in my product, the Defender from the East West Way. It has vitamin C in it as well, along with zinc. So that's a great way to kind of keep your immune system primed. Remember, gut health is incredibly important, so getting probiotics in and really making sure you're eating foods that are not inflammatory. Those are things that also help to boost your immune system and hopefully keep you well. And once you do actually get a virus, the goal, unless you're working and unless you're having to speak or really show up for a job, the goal is really to keep all this congestion loose, right? Because when it dries up or when it thickens up, that's when you're going to get, you or your children, by the way, that's when you guys may get the ear infections, the sinus infections, maybe a pneumonia or a bronchitis. And that becomes a whole ordeal for everybody. We don't want that, right? So trying to keep that congestion loose, again, the hydration becomes important, and then steaming. So literally you can boil a pot of water, throw a towel over your head, add eucalyptus or rosemary. Those are some of my favorite. Lemon essential oil is another one that I like a lot. But adding some of those in to really break up congestion and loosen congestion is a way to kind of keep everything nice and loose. Now, ironically, kind of the same rules apply if you guys are somewhere in the world dealing with spring allergies. Who's already in full-blown spring allergy season? Now, again, weird weather. 3 weeks ago, we were dealing with pollen. Then we had a freeze, so we don't know where the pollen situation is going to land. But usually in April, it's beautiful here in Atlanta. It's absolutely stunning with the dogwoods and all the flowers blooming. But folks are miserable. They are swollen eyes and runny nose and not feeling very good. But the same rules apply. We want to loosen everything up. You want to stay hydrated. You want to lower sugar, and you want to get plenty of rest. So prepping for allergy season is kind of like prepping for cold and flu and sick season. There are a lot of similarities there. Here's what I like to do kind of in addition to that when we're thinking about allergies. Adding in foods that beat histamine, right? My favorites are things like pineapple, some of the citrus fruits. It has bromelain and quercetin in it. along with high-dose vitamin C, all of which really help you to control your allergy response. So, big gut health for both allergies and for immune health, rest and hydration for both, astragalus for really getting that immune function where it needs to be, and then quercetin and bromelain in particular for lowering the histamine response or the allergic response. Okay, so there are answers, and then other little things that make a difference, like leaving your shoes outside, rolling up the windows of your car, making sure like you're changing your clothes when you come into the house. Those are ways of decreasing your pollen count inside the house. All right, so that's allergies. Everyone been okay? No one really getting sick or suffering from allergies? I don't know where you guys are. Again, you can share where you are. I love learning where everybody is from on some of these lives, so go ahead and share where you are and let us know. And maybe you're not dealing with any of this because you're still in like 5 feet of snow. Who knows? But that's the fun part of bringing everybody together on some of these platforms. All right, I'm going to move on from immune health. There are, let's see, 2 more things I wanted to talk about, and then we'll take some questions. One was the birth control pill. How many folks are on the birth control pill? Anybody want to really talk about their experience with the pill? So here's the story. When we're talking birth control, we know we need the birth control pill, but that's not your only option. There are other options for birth control as well. There's the IUD, there are other barrier devices for sure, there are the implants. Now, I'm not a fan of a lot of these, but when girls or women need birth control, they need birth control. But an interesting study just came out, I found this fascinating, talking about what birth control does for your sex drive and even who you might be attracted to. Did you know that your birth control pill can change who you're attracted to? So before you jump and get engaged or married, maybe come off the pill first to make sure you still feel the same way about that particular person. But here's what's happening. I think birth control pill, as we know, changes your hormones, changes sort of the chemistry in your body, and at the end of the day, chemistry and your hormone levels and your numbers are all connected. I posted yesterday a little bit about that connection, right? Talking about the emotional scale and how so many of us are more anxious or stressed or upset right before our periods, or if our periods are in a place where progesterone levels are really low or estrogen levels are super high. And that can make us feel depressed or anxious, make us angry at people we probably don't need to be angry at, and really bring our stress tolerance and our stress bandwidth down, where every single thing gets on our nerves. So same thing's happening with the birth control pill, right? Now they're talking about it in the context of libido and even attraction, but I've seen it with mood and the ability to focus and concentrate, and even weight and weight gain, right? Some people do great on the pill. It seems to suppress all their hormones and manage them well. Other folks gain so much weight on the pill or just feel terrible. They get migraines, they get acne, so many symptoms that I hear about over and over again. I don't know if you guys have been on the pill and what your experience has been with it. In practice at Center Spring MD, typically what we do is go for a very low dose pill. So we'll do like a low estrin or a low estrin. Those are usually my go-tos and my favorites because the hormone dosing is pretty low. So that's a preference for people who are very hormone averse. We may try a non-hormonal or recommend a non-hormonal IUD to see if that might be an option for them. So again, you've got to be careful with birth control, but for those of you who take birth control and you notice you just feel terrible taking it, you may actually have more of an issue with hormone metabolism, right? So whether it's your own hormones or hormones someone's giving you, or if you're in perimenopause or menopause and you're taking bioidentical hormones, those are things that can absolutely impact how you feel, especially if you're a poor hormone metabolizer. So if you're not able to break estrogen down, if you store, like if you have the genetics for storage, and some of these we talk about, like COMT or MTHFR in particular, then yes, indeed, those are going to make you feel bad no matter what hormone is given to you. And you might even be the same person that no matter what medication is given to you, you feel horrible or terrible. So what's the answer? The answer is microdosing, teeny tiny dosing, little doses of hormones, little doses, the tiniest version of the birth control pill you can get away with, or even doing an IUD instead. baby doses of medications, actually even doing pediatric doses. And that's what I do a lot of with patients that do have MTHFR. I found that they actually need pediatric dosing for their hormones rather than the standard adult dosing because they have such a poor tolerance for medications. And again, a lot of that poor tolerance is connected back to the liver and what the liver is or is not doing. So birth control, remember, has consequences, maybe even to the point of determining who you choose to be with, so just keep that in mind. And remember, there are a lot of different options for birth control. The pill is not your only option, but it is a conversation that you need to have with your provider. All right, one more topic and then we'll open it up to questions. Now let's talk about, this is bugging me because we just came from Mexico. For those of you who follow me, you might have seen this on my stories. I didn't post too much, but we did come from Mexico. The children were on spring break and took them down there. They had an amazing time, of course. I wasn't as mobile as I like to be, although things are definitely progressing with this Achilles injury for sure. So that's the good news. But you know, while we were down there, everything in the news was talking about like the Americans that got kidnapped and how the cartel was involved and there was suspicion of drug trafficking and all this other stuff. So this is becoming a very big problem for the United States in particular, and I would even venture across the world, where we are seeing more and more exposure to illegal drugs. We have medications sometimes that tourists are buying over the counter that is actually maybe laced with fentanyl, which is highly addictive, and then in turn will trigger maybe an addiction issue or the desire for more. So really the message needs to be, let's not be drug dependent. I don't know why 80% of the world's pharmaceuticals are used by the United States of America. Why are we so drug dependent? Why is it you need a pain medicine for everything, an antibiotic for everything, you know, an anti-anxiety, an antidepressant? You know, we have got to learn, and I'm pretty passionate about this, we've got to learn to bring it down. We have to be less and less medication dependent as we move forward. First of all, we're having a supply chain issue with many of the medications. Secondly, there is a body burden to any medication, right? There are going to be side effects. So even if you microdose them sometimes, there are going to be side effects. And those are side effects that you have to take seriously and really look into. And we also have to understand now that our drug supply system might be tampered with, right? And that addiction is real and the mental health crisis is real. And these are things that continue to grow and escalate, you know, right before our eyes. And it's probably connected to the homeless crisis too. So what's the take-home message for all of that? The message is really fewer medications. Really look for natural options. Look within your own lifestyle and see if there's something you can change or manage. Think about things like gut health and immune health that keep the majority of viruses and illnesses away or at bay, because that ultimately is what is going to keep you well. We talked about this so much during the pandemic, and I felt like I went blue in the face, maybe even got burnt out a little bit, to be honest, talking about the importance of your overall health, thinking about health holistically, not as a chipping off of like this person's taking care of that and this person's taking care of this, but nobody's bringing it all together. We have to start thinking about our health that way, because as we've seen over and over again, it's all connected. If the birth control can change who you're attracted to and who you marry and who you end up with, imagine the connections that we haven't even begun to understand yet when we talk about the many different bodies and what we're putting in them and how it plays out to determine what our life would look like. All right, I'm going to stop there for a second, but I do want to ask a couple of questions. First one, of course I'm losing my voice, but first one is, has anyone tried the new shampoo and conditioner from the East West Way? I would love for you guys to do a testimonial if you like it, and I will send you a bottle of each. So let me know if you like it. DM us. You can send it to hello@drtaz.com, COCTORTAZ.com, and we'll hook you up and just take advantage of your experience really with it. My husband swears it's his favorite shampoo ever, and he's a product guy, probably more than me, believe it or not, but he absolutely loves it and swears by it. So if you guys like the shampoo and conditioner, let me know. If you want to purchase it, remember it's on the Dr. Taz site. You can go to drtaz.com. You can also go to the East West Way to see the entire line of products that I've curated and formulated based on my experience in the practice. So I wanted to ask about that, and then wanted to remind everybody to join the Superwoman Circle. So the next coaching session is actually next week, and here's what we're doing. We're sending you guys the quizzes so you can personalize your plan for yourself. So there's a weight loss type quiz that you can take, and we're going to talk about your results in the practice and help you sort of, again, curate and formulate a plan that works for you. And we're also going to be talking about hair loss. Spring is kind of that at least that's the mood I'm in. I don't know about you guys, but it is a reboot time. I want to get out of this boot, and I want to spring forward and like get healthy again, get to working out again, and really kind of claim myself back. It's a common time when hair regenerates, right? When hair regrows, the follicle opens back up. We want to take advantage of that as well and talk about the chemistry of hair. Hair, remember, is your vital sign, and so what your hair is or is not doing is a reflection of your overall health. So spring is a great time to dig into that topic as well and really understand the roots of your hair loss and what might be happening, because we're gonna make this spring a good one. I don't know, I don't wanna say, I'm not a negative person, so I don't wanna say I've had a dark winter, but it's not fun being injured and not doing the things you love to do. So I wanna have an amazing spring and summer, and I am determined to get there, and I hope you'll go there with me. So join the circle, we'll have these conversations. It's pretty easy to join. Go to drtaz.com/superwoman, and you'll see the links there to join, and I look forward to seeing you next week in our coaching session. All right, let's stop for a second and take some questions. I'm seeing a lot of comments, a lot of hellos. For those of you who join every week, hello, thank you for joining. And hey, send me ideas, right? Like, send me ideas, send me stories. And if any of you ever want to come on like live and tell your story, your healing story, or something you're struggling with, then make sure you let us know that as well. We'll be happy to bring you on here so that we can continue to inspire everyone. Remember, if we each touch even 5 people, we've made a massive, massive difference. And what I usually say is that every woman, sorry guys that are on here, not trying to knock your influence down by any means, but women, remember, take care of at least 10 to 15 other people in their lives. So every time they make an impact on one of them, their circle reverberates and reverberates and reverberates. So that's super exciting. Okay, I'll shut up. I'll keep talking. So let's take questions. Let's go for it.
So the first question is from Instagram, and the question reads, I never had allergy issues until the last 3 years. Is this normal?
Allergy issues. So let's talk about what influences allergy issues. This is a question from somebody on Instagram today saying they never had allergy issues until the last couple of years. So many theories on this. First of all, theory number 1 is that your hormones change what you are and are not allergic to. So many women and men will see shifts in their allergies as they hit different stages of their hormone journey. So for example, after pregnancy, perimenopause, menopause, you'll see some shifts in what you can and cannot tolerate. And then when testosterone drops, you'll see some shifts there too. Secondly, your gut health is connected to allergies. So if you've had a change or you've changed your diet, it may change what you are and are not allergic to as well. So that's another factor. And then there are some theories that the immune system just changes, right? There are changes and they happen for different reasons. So yes, absolutely. But if your allergies are worse than they have been in any other previous time, then you are having a higher histamine response. And about 80% of the time, that high histamine response is actually coming from the gut. And the gut is where histamine is produced. So if you've had a lot of sugar, alcohol, dairy, gluten, processed foods, packaged foods, you have a higher load of yeast in the gut, which in turn overproduces histamine, which makes your allergy symptoms awful.
Okay, and then we have another a topic about the birth control. Someone commented, Mirena IUD made me lose hair.
Yeah, so I've seen the IUD do different things to different people. This was a comment on the Mirena IUD made me lose hair. So the IUD can do that. We're not sure if it's the metal, right? The copper zinc ratio, if it's the device itself. We're not sure exactly why. If you had a progesterone secreting IUD, then absolutely that might be a part of the story, because remember, progesterone can be an androgen that will trigger hair loss and acne and many of these other symptoms too. So that could be why as well.
And another Instagram question, what do you recommend if you have low progesterone?
Okay, low progesterone. So that's a question and that's an issue that I see in practice a lot. It's actually something I dealt with myself. That was a big part of my hormone journey. Low progesterone can be because you're not getting enough fats in your diet. So you need a little bit of olive oil, you need a little bit of ghee, coconut oil, MCT oil, because fat is the building block for hormones. You can increase progesterone by adding in herbs like Vitex or chasteberry. That's an indirect way to increase progesterone. And in addition to that, you can take bioidentical progesterone, again, in very small doses to help with your overall progesterone balance.
Okay. And then we have another question. How do we strike the balance between using medications to feel better and not taking too much? Any good brands you suggest?
All right, this is a question about taking medications and the balance of medications. So, it's always a hard decision to go on a medication or not go on a medication. It depends on what your health issues are, right? So I think you need a provider, a good provider who can step back and look at the whole picture and be like, these medications are absolutely necessary, whereas these other ones, there may be a different way to handle it. I would challenge you guys, if you're on more than 3 pharmaceutical medications, look carefully at your health. What are you doing? Are you not hormonally balanced? Are you not eating the best way for you? Are you having issues with your life? Are you too stressed? But more than 2 to 3, probably there's something bigger going on unless you're entering your health journey very late and you've ignored things for a long period of time.
We have a comment about the shampoo and conditioner.
Yes.
She said, my house smells like a spa when I use it.
Love it. You know what that scent is? I don't know if you guys are familiar with Palo Santo. It's the scent of Palo Santo. It's in there on purpose. It's actually, this is where I get woo-woo a little bit, but I love it. It's a scent and a tree bark, actually, that's supposed to ward away negative energy. So it's supposed to actually uplift you. It has a higher vibration in general. So that scent is there on purpose.
And what do you suggest for weight management / loss for a 60-year-old female who's had full thyroid removal and full hysterectomy? Provider has just prescribed 5 mcg of estradiol. Will this reduce the menopause?
Okay, that was a long question. Let me try to summarize it, all right? Hey Travis, how are you? Had my hair done, that's why it looks so good. You've seen me without it done too if you've been in the practice, so don't expect this every single time. But anyhow, so this was a really long question about weight loss. 60-year-old hysterectomy, sounds like thyroidectomy, did I get that right too? Okay, hysterectomy and thyroidectomy, meaning no uterus and no thyroid. So hormone replacement, especially for the thyroid, is going to be very important to get the chemistry stabilized. Here's the story with estrogen. If estrogen is prescribed where your body can't break it down, it's not going to help you with weight loss. It'll help you with the symptoms of maybe not sleeping and having hot flashes or being depressed, which is really important to manage, but it's not going to help with weight loss. You have to make sure that estrogen is being metabolized effectively. So I would get the hormones balanced in a good place, then I would work on building muscle, I would work on gut health, and then from there, hopefully you'll see a change in your weight overall.
Again, another question about the shampoo and conditioner. Do you think you will be offering travel size shampoo and conditioner?
Yes, I'm actually back and forth. So this is a question about travel size for shampoo and conditioner. Sorry, I didn't mean to interrupt my beautiful question presenter here, but anyhow, you'll probably need to show her face at some point. But the question was about travel size for shampoo and conditioner. Yes, we are working on it actively. We're trying to get all those pieces together, but there should be travel sizes. I don't have a timeline yet because production takes forever on everything nowadays. But as we get closer, I will let you know.
Ooh, this is an interesting question. Where do I start the journey on perimenopause with endometriosis?
All right, so that's 2 stories, perimenopause and then endometriosis. Do we have anyone with endometriosis listening today? That is a really tough gaslit diagnosis, right? Women knock their heads around for years before they finally get that diagnosis. Well, here's something I learned. This is why I love to practice so much. Here's something I learned, I think about a week ago from another patient, that there is now, when you do a cervical, like when you do the pap smears, there is a test called the Receptiva diagnostic test that can actually determine if you do or do not have endometriosis. So making progress there for sure. The other ways we evaluate for endometriosis, and by the way, March is Endometriosis Awareness Month. If you didn't know that, we probably should be talking about it a little bit more. But the other way that I get suspicious, I see someone with issues breaking estrogen down, and I see a thickened endometrium. So the endometrial lining right there in the uterus is more than 6 millimeters or so. I get super suspicious of endometriosis. Or if somebody has pelvic pain and rectal pain the majority of the month, and pain that worsens as their period approaches. So those are some of your clues about endometriosis. Now, how does that apply to perimenopause? So in perimenopause, you have a lot of hormone fluctuation, right? You may have worsening issues with estrogen and estrogen breakdown, and you may have, again, a bigger gap between high estrogen and low progesterone. So the East-West philosophy of dealing with both of those is to clean up the liver. That becomes a starting point. So adding in milk thistle, adding in calcium glucarate, getting in a lot of greens and fiber, maybe doing a green smoothie every single day. Those are ways to detox the liver, which over time helps both of those conditions. And if you are going to need support, it's usually support in the form of herbs or supplements that build progesterone, because progesterone really is the hormone that helps to balance out the estrogen issues that we see in both. So that's, again, like probably a endometriosis and perimenopause for dummies version, quite honestly. It needs a lot more massaging and nuancing and explanation, but at least it's like hopefully igniting a tiny pearl in you of the things you might need to be thinking about.
Okay, I think we have time for one or two more questions.
Okay, just a couple more questions.
Let's see. What do you consider to be a low dose of progesterone?
Oh, great question. I love this question. So the question was, what do I consider to be a low dose of progesterone? I've gone as low as 10 milligrams, like 10 milligrams of progesterone as a cream, or, oh no, that's not the lowest. What am I talking about? We've done the 6.25 milligrams of a slow release progesterone that we've had compounded. So that's a great starting point for people that are very hormone sensitive. For the creams, I'll usually do the 10 milligrams.
Okay, and this is another great question. Great questions today.
I know you guys are on it today. I like it.
Are artificial sweeteners recommended for weight loss?
No. Are artificial sweeteners recommended for weight loss? No. If you are substituting an artificial sweetener for sugar, we have this debate at home, by the way, all the time. It really gets on my nerves. So my husband and my daughter would drink Diet Coke, which makes my skin crawl. No, it's not even Diet Coke, it's Coke Zero, which makes my skin crawl, because part of why I think I got sick in my 20s is Diet Coke. Whatever, we have this big argument, but they're like, it's 0 calories, it's 0 calories. No, it changes your chemistry, it messes up your gut, it impacts the hypothalamus. No, the goal is to have real sugar, but to have less and less and less and less of it until you train your palate to not really want it anymore. So I can't say no. I think I've said no enough. The answer is no. All right, let's do one last one, and then I know we're going over time a little bit, but we can do one more. Let's see.
We have another question. What's the best way to test hormones? I've heard.
Oh, good one. Good question. Goodness, they're on it. All right, question about testing hormones. All right, this could be a whole live, and maybe it's what we'll do next week. But testing hormones can be done in multiple ways. There's saliva hormone testing, there is urine hormone testing, there is blood hormone testing, right? All of those can provide you valuable information. Here's the debate. In conventional blood testing, the standards that are set as normal, my favorite word that keeps getting used over and over again, are quite honestly wrong. So what usually happens is you go in and you ask for your hormones to get checked, and you come back and everything is marked normal. Well, what we do at Center Spring MD, we have a completely different range of normal. So even using LabCorp blood testing and testing for the right metabolites, we are able to understand what's normal and what's not normal and where you might be. Now, the advantage of pairing that information with a stored hormone test, like the Dutch test, or a ZRT test, or a Genova saliva test, just gives you more information, and it actually helps to pull out some of the hormone patterns that might get missed and a standard lab test. I like doing both, and then kind of having the blood test to continue because we can run that through insurance and keep an eye on that. Okay, oh my gosh, all right. We have talked about so much stuff, and I feel like there's still some questions I missed, but remember, join the circle. We attack a lot of these questions, but more importantly, we work on personalizing your plan, keeping you motivated, and really getting you back to a healthy place. The next coaching session, remember, is next Tuesday, and you still have time to join. Go to drtaz.com/superwomen. But look, these platforms are about bringing us together, inspiring one another, and really, really making a difference when it comes to conversations around your health, the health of your families, and really the health of our communities. And medicine continues to go downhill, quite honestly, so we've got to be inspired by one another. So if you want to be on the show and you want to share your story and get advice, email us. Remember, the generic email that you can use across the board is hello@drtaz.com. That's DOCTORTAZ.com. Let me know if you want to be on one of these lives with me, you want to be featured in one of my podcasts, or you just want to leave a testimonial for the shampoo and conditioner, or any of the things that we have going on across the board. It's a busy place in my world, but hopefully that brings us together rather than separates us, and I can't wait to hear from all of you. So thank you for joining today's live. We'll be live again next Tuesday, and if there are things you want to hear about, make sure you let me know. All right, I'll see you guys next time.